Hi, this is the nursing professor. We're going to go through 3 parts of studying for pharmacology. All right, so first, let's get the basics out of the way. And so we know that we need to know the rights of administration to avoid any problems. Right client, right drug, right dose, right time, right route, right documentation that you did it. Remember, if it's not documented, it's not done. Right education is given to your patient. The patient always has the right to refuse. The right assessment, that you're given medication based upon an assessment, because remember, administration of medication is an intervention when you're talking about the nursing process. And to evaluate, was it effective, was it not? Because if it wasn't, then we need to contact the provider and let them know that, because perhaps something else needs to be ordered. Okay? Know the difference between pharmacokinetics and pharmacodynamics. Pharmacokinetics, remember, that is when you're looking at the association of medications as it undergoes processes in your body in order for it to give the desired effect. For example, 4 parts we need to always think about. ADME, absorption, distribution, how it distributes itself around the body, metabolism, and excretion. Okay, so ADME is associated with pharmacokinetics versus pharmacodynamics is where you're looking at the interaction of the drug with the body. So we expect for a medication to do what it is prescribed to do. For example, if we're taking antihypertensives, the expectation is that our blood pressure will be managed. Okay? All right, then we talk about routes of administration. You want to know which one is the quickest route. And so if given the choices of oral, IV, injections, topical, inhalation, which one do you think will be give you a faster response? The answer should be IV. So be aware of that, because many times that is embedded in a question. The other thing to be aware of as well is to know your basic dosage calculations, because usually 1 or 2 of those will show up on a final exam. Know your high risk or high alert drugs, and these are drugs that are could possibly be fatal if administered incorrectly. So think of things like your blood thinners, Coumadin or Eliquis. Think about insulin. Insulins can be very dangerous if they are administered in the incorrect amount. Look-alike, sound-alike drugs, be aware of those. So this is why, again, if we follow the rights of medication administration, then we will make sure that we're avoiding those errors, because we would know what that medication is that we are administering. All right, be aware of potential side effects. For example, if you give pain medicine, a narcotic, be aware that that person might have issues with constipation. And so you should be aware of potential side effects or adverse effects, so that you can look for those and you'll be able to address them as early as possible. Also, look for if a medication, again, going back to a narcotic, it might have some GI upset or some drowsiness or itchiness. And so those could all be adverse reactions to an opioid. And so we want to be aware of that. We want to look at individual considerations that we have to make when we're administering medications. For example, someone's body weight, especially with children, we use body weight quite frequently to come up with appropriate dosages. Also, many of the critical care medicines, the dopamine, those drugs are based on one's body weight, chemotherapy. And so it's very important that we are aware of that. Age is also a factor. Sex is also a factor. Females are different from males, and much of that is about the distribution of fat. So remember about the pharmacokinetics we talked about in distribution. Genetics. Sometimes people have an enzyme that might cause a problem. So we think about people who are gluten, who have to avoid gluten. Then some of the medications are actually formulated from a gluten derivative. And so if a person has a problem with that, that might be the cause of it as well. Tolerance, accumulation, psychological factors, diet, and medical problems are all individual considerations that we must take a look at when we are administering medications. Remember, when we're talking about accumulation of medications in the system, we're looking at things like half-life. And so when we're talking about a half-life, then we're looking at the amount of time that it takes for the body to eliminate some of that. So some medications have a long half-life, some of them have a short half-life, and we need to be aware of that, especially if someone has problems with either their liver or kidney, if that is the organ where the medication is excreted. Then we're going to break this down going into the various systems. And so the next video, we will start to talk about, we're going to start with neuro, we're going to go down to eyes, ears, respiratory system, cardiovascular, and then the last video on pharmacology will talk about the remaining endocrine immune system infections. And I'm not going to be able to go through all of the medications because you know there are tons of them, but at least we can talk about classes of drugs and know generally what happens with those drugs. All right, so I will see you in part 2.